Once a smaller rollout has been completed, the nurse is led to the next step, evaluating the outcome of the EBP practice decision. The nurse and other stakeholders consider whether the EBP outcome was a success, what unanticipated barriers to change they encountered, and whether these barriers are surmountable. If the outcome was not successful, reconsider whether other important factors of practice, those of clinical expertise and patient values, were correctly appraised prior to the intervention. Or, was it due to inconsistent adherence with the plan, a lack of skill in implementation, or was the evidence incorrectly interpreted? Should the EBP change implementation be altered and attempted again, or should the plan be aborted? Just as important to consider is what went right. If the intervention was successful, you can replicating a full-scale rollout. Are there other stakeholders to consider on a greater rollout measure? Can we take advantage of the stakeholders' testimony who found the outcome to be a positive one to increase buy-in? Communicating a success is important to gain further momentum. However, it is also important to communication an attempt at change that did not go as anticipated. Here we are considering Step 6, dissemination of the outcome results. By sharing results of attempt at change in practice toward EBP, the nurse participates in its scientific knowledge base which can be used to support or alter similar endeavors. The first 3 steps, from asking the question to analyzing the available literature, is worth considering writing and publishing, to share with colleagues who can go on to use the information in tailoring their own EBP changes. If the EBP change becomes a new established process, then sharing the information via departmental in-services is important to make everyone aware of the change in practice, and to allow other departments to consider how it may affect their services. Posters at conferences can be a great opportunity to share the information, and to spark the interest of other providers to consider a similar change. Grand rounds can be an opening to discussing EBP. Nurses have an obligation to offer their experiences to journals for publication, advancing the audience beyond a single institution and allowing knowledge to be built upon.